This video presentation will deal with spirometry. Spirometry is the measurement of lung volumes, and the reason why you measure lung volumes is so that you can assess lung function, see whether things are normal, abnormal, or above normal. Medical assessment with spirometry, measuring lung volumes. Lung volumes are functional and anatomical volumes that cannot be subdivided. You're going to hear when we start looking at things about volumes and capacities. The difference is that a lung capacity is two or more lung volumes added together. So lung volume is a functional and anatomical volume that cannot be subdivided, and a lung capacity that's two or more lung volumes added together. Here you see an individual hooked up to a spirometer. He will breathe in and out of that spirometer. This big plunger here is for calibrating the spirometer. The device that's measuring it is this light-colored thing back here. That's the actual spirometer, and then it's hooked up to a computer to record it. There's one thing wrong with this picture, and I can't tell. Maybe it's not really wrong. I guess I shouldn't say that, but your nose needs to be clamped off. You can't breathe through your nose when you're doing this because it'll make your measurements wrong. See, I put this one in on purpose. There's usually a little nose clamp that you put on because you want to do all the breathing through this. You're not going to measure the lung volumes very accurately if you've got air escaping through the nose. This is a little spirometer. See, it's very compact. Here's where you breathe in and out. Here's where it's recorded, and this part of the unit is actually going to measure it, and it also gives you a printout. That's a handy little spirometer. I like that. Convenient, portable, lightweight. Here's the kind that we've used for years in the Lenore Ryan Anatomy and Physiology Laboratory. It's kind of archaic, you can tell, but it works. You put water in the drum, and then this is a cylinder, and when you blow in, see, they don't show you this, but see this little tube coming into the bottom? That's where the person has the end of that in his mouth, his or her mouth. And when they blow in, the drum goes up because all the air goes into the drum, makes it lighter, and it goes up. And then as this elevates up, there's a little gauge here that you set to 0, and it spins around, and then it gives you the measure of how much air went into that cylinder. It basically can only be used for measuring vital capacity, which I'll show you in a minute. Vital capacity is very important, but you need to know the other volumes too. But it's a good, quick, easy way and an inexpensive way to measure a vital capacity of the lungs. This is what we use mostly now. This is a little handheld spirometer. You set this needle to 0, then you put a mouthpiece on it. You breathe in as hard as you can, and then take it all in, and then you let it all out, and that will also tell you your vital capacity. Then this is the kind of a spirometer that they gave me after I had surgery. And basically it's a simple little unit. They give it to you to take home with you when you go home. You basically blow into it and see how far you can make it go up. And the reason why they call it an incentive spirometer is you're trying to increase your performance each time. And it does as you work on it and get better at it. But the whole purpose of this is called respiratory therapy, is to keep your lungs from getting infected. People often get pneumonia and other respiratory infections after surgery, and so having an incentive spirometer and doing it off and on whenever you feel like it, sometimes it hurts to do it, so people don't feel like doing it. But the more you do the incentive spirometry, the less likely you are to get a nasty lung infection. Okay, this is a spirogram, which is a recording. This is the volume on the y-axis of gas in the lungs, and then the time on the x-axis. And don't look at all the words yet, just look at what happens. This is normal breathing right here. You couple normal breaths, okay? And then what you do is you take in as much gas as you can into your lungs, and then the next thing you do is blow it all out, okay? And then you resume normal breathing. So just follow the line right now. This is normal breathing, okay? This is taking in as much as you can. See, there'll be more gas in the lungs when you take it in. And then you blow it all out so it goes down. And then you resume back to normal breathing. So let's talk about the volume of normal breathing. The volume of normal breathing is called the tidal volume. And that can vary with the individual, but it's usually in the neighborhood of 500, 600 milliliters per breath. Okay? And so up and down, you're just breathing at rest. And then you take a big breath in, okay? And the volume from right here to the peak is called inspiratory reserve volume. See, they have it marked with this arrow over here. That's taking in as much as you can after a normal inspiration. And that's usually maybe about 1,000 or 1,100 milliliters is the volume there. And then you blow it all out, okay? And this difference right here between the normal expiration and the extra you can expire is called the expiratory reserve volume. And you can see the expiratory reserve volume is smaller than the inspiratory reserve volume. Okay? And then you go back to a normal breath, and that's tidal volume again. Now there's one more volume. These are the basic volumes over here. It's called residual volume, and that's the amount of volume of gas that's left in the lungs that no matter how hard you breathe, you can't breathe it out. So see, here's your four basic volumes, and the four main ones. Tidal volume, normal breathing. Inspiratory reserve volume, the extra you can take in after a normal breath in. Expiratory reserve volume, the extra you can breathe out after a normal expiration. And then residual volume, the amount that is left in the lungs permanently. You can't get that out no matter how hard you try. Now there's two important capacities here. They show four, but the two they work with the most is vital capacity. If you look at vital capacity, that's the total capacity that you have when you breathe in maximally and out maximally. See, that's called vital capacity. That's as much as you can do. You can't do any more than that. That's maximal exchange with one breath. Okay, and I'll show you. That's very important capacity, and I'll show you what it depends upon in a future slide. Okay, vital capacity then is what? Expiratory reserve volume plus tidal volume plus inspiratory reserve volume. See, it's determined by adding a bunch of volumes together. Therefore, it's called a capacity. Okay. And now we have the other one that's very important to know, and that's the total lung capacity. And that is if you could, this is how much gas there is in the lungs after maximum expiration. And this is if you could empty it all out, which you can't. But that, from the zero line all the way up to the peak, that's called total lung capacity. And you can see that's residual volume plus expiratory reserve volume plus tidal volume plus inspiratory reserve volume. So therefore it's called total lung capacity because it is determined by adding a bunch of the volumes together. And then they show you two more which aren't used as much: inspiratory capacity and functional residual capacity. See, inspiratory capacity is tidal volume plus inspiratory reserve volume. I'm not going to ask you that one on the test because they never used it, but I mean they use it, but it's not commonly used. And functional residual capacity is the expiratory reserve volume plus the functional residual plus the residual volume. So the expiratory reserve volume plus the functional plus the residual volume. I better say it right one time. The expiratory reserve volume plus the residual volume equals to the functional residual capacity. But those aren't the primary indicators. Okay, so let's review. Normal breathing is called tidal volume. The extra you can take in is called inspiratory reserve volume. The extra you can breathe out is called expiratory reserve volume. And the amount of gas that you can't get out of the lungs is called the residual volume. Okay? So then what you see here is that vital capacity, I don't think they show it on here. Where is it? Oh, here it is, vital lung capacity. See, is the expiratory reserve volume plus the tidal volume plus the inspiratory reserve volume. That's that one. And the total lung capacity is the inspiratory reserve volume, the tidal volume, the expiratory reserve volume, and the residual volume all added together. Vital capacity, and you know what that is now. It's affected by sex. Generally, males have a bigger vital capacity than females. It's also determined by, it's affected by age. The older you get, the lower your vital capacity gets. It's also affected by height. Tall people tend to have very great vital capacities, and short people, of course, have lower vital capacities. It's also affected by illness. Any kind of chronic or acute respiratory problem would affect your vital capacity. And finally, you might suspect this: vital capacity is increased by physical training. Trained athletes, people that run and exchange gas on a high level, they're going to increase their vital capacity. So sex, age, height, illness, and physical training affect vital capacity. So in conclusion, measuring lung volumes by spirometry is essential in assessing lung function. This has been a presentation on spirometry.